I think you probably realize what a pro I am. And if you don't, well, then go to YouTube, because this guy here has got 1,000. Yeah, you heard me, 1,000. I think actually it's 1,100 now subscribers. I've got over 1,000 subscribers. I believe I am in a position to monetize my YouTube account. If that's not an influencer, I don't know what is. So in order to try and, I'm always trying to improve things. So I have, I've noticed the audio is often a bit ropey. I don't know what it's like on Instagram, but often on Facebook, it's a bit ropey. And I'm assuming it's working. So I've done something to try and improve that. Yes, I have. What have I done? I'll show you what I've done. 212. How's that? How's that for the audio? I've got a new setup for the audio. Yes, I have. Now, I'm a bit embarrassed. Good God, it looks ridiculous, doesn't it? I mean, just got it today. Oh, I think the audio is better. Now, we've done a poll on the Facebook page, the private page for the people who've been to the clinic, and resoundingly, the poll has come in favour of keeping this here for better audio. I think the figures it was overwhelming. I think it was something like 5 people voted to keep it and 2 people said it should be moved away. So with that sort of, with those figures, it's hard to, I said the alternative is to have it like that, or I can have it like that, just like that. So is the audio, is anyone, oh, hi, Joe. Joe's here. Hi, Joe. Joe's on Facebook. Someone's on Facebook. Joe, I mean, Instagram, I think the audio is all right. But Joe, what do you think about? I've got to be honest, I feel a bit ridiculous. I didn't think it would look quite so ridiculous. I'm thinking of doing my book. What book you say? This book here. I'm thinking of doing my book, audio book, and I thought this would be good, wouldn't it, to do an audio book, wouldn't it? You could do this sort of thing. It's a professional setup, guys. I'm not messing about here. Yeah, we got a professional setup here. This is the 7 p.m. Q&A with JJ Staiano. If you've got some questions, please post them below or feel free to get in touch live on the broadcast. So today what we've got is we got questions about scars and mummy makeovers and other things. Move it away from your face, please. Oh. Well, Roxana, that was a thing we said, whether I put shall I put it like that? But the audio is better like that, isn't it? And I can hide. Still there? Oh, yeah. Anyway, I think it looks slightly ridiculous there. I've got to be honest. I mean, that looks ridiculous, doesn't it? I don't want to tell you what my wife thought of me buying this contraption. But then she thinks the whole thing's laughable. Anyway, there you go. Let's put it like that. Let's get that. Oh no, that's you're supposed to have that there, aren't you? Because that's a pop filter. It's a pop filter, guys. Right, let's go like that. If I go like that, that should be all right. Anyway, we'll assume that that's there. Further away. Let's just go with this, shall we? Anyway, I hope you appreciate all the efforts that I'm making to make this the home studio in here. So good. So I got, oh God, what have I done? I've got some questions. If you've got any questions, please, as you know, please post. Oh God, sorry, I've just put a question up. But you know what? While I was doing all that, I'm going to take that question off, because while I was doing all that, people were saying stuff on Instagram and I was ignoring them. Here we go. Toby, how long does it take to have surgery from consultation? Well, there's a minimum, Toby, of 2 weeks from surgery to consultation, and that is a cooling off period, a bit like when you get a credit card. You have to, if you want to change your mind about the credit card, you can sort of cancel it within 2 weeks. And it's the same with surgery. So there's a minimum period that, recommended by BARPs for 2 weeks. Now, I should preface that by saying what sort of surgery you're talking about, because we do see and treat surgery for moles and cysts and minor procedures where you have it on the day. But I'm assuming you're talking about a bigger operation like a general anesthetic case, a tummy tuck, breast reduction, breast implant, something like that. So minimum 2 weeks. But obviously then it depends on availability. Availability is difficult at the moment, Toby, in terms of the COVID and the private hospitals all being used by the NHS. I'm really hoping that we're going to start seeing some green shoots of recovery in terms of the private hospitals allowing us to do more work. If the NHS can start to do more in the NHS, then the private hospitals will be able to do more private work in the private hospitals rather than the NHS using the private hospitals. At the moment, how long until surgery? I'm going to say, I'm not good at this, Toby. You put me on the spot. May? When's May? March. We're March now. April, May. May can't be June, can it? Have May, June. Maybe May. Maybe June. May, June. A couple of months, Toby, I think. But the people in the office know better for the waiting list sort of type of thing. Zoe says on Instagram, hashtag Ask JJ. And I can see, what is it? Olivia has done hashtag Ask JJ as well, so it hasn't gone unnoticed. Hashtag Ask JJ. Considering getting a breast reduction and uplift, would you recommend to wait until having kids? Thanks. Zoe, yes, I would. Yes, I would. The advice from a purely surgical point of view, if you are thinking of having kids or if you are thinking of changing your weight, either way, if you want to put on weight or lose weight, then I would recommend that you do those things prior to having body contouring surgery. Breast reduction and uplift is one operation. So an uplift is part of a breast reduction. So that would just be lumped into sort of breast reduction. But obviously part of it is tightening the skin and making the size and the shape as perfect for your body frame as we can. And things can be changed by having children, and things can be changed by putting on and losing weight in an unpredictable way. That's the problem. It's unpredictable. I'm not going to say if you have children, they'll get bigger or they'll get smaller, they'll droop. Those things might happen, but they might not. But it's unpredictable. So if you want a predictable surgical result that lasts, you're better off doing it when you've got a stable playing field. So ideally, you should wait to have children until you finish having children. Now, some people say, well, that's going to be many years. But if that's going to be many years, you can have surgery now, as long as you accept if you do have surgery, if you do have children, then that might affect the result. So yes, so directly asking the question, should I wait until I've had kids? Yes, you should wait until you've finished your family before having any breast or body contouring surgery. The other thing about breast reduction is it might affect your ability to breastfeed. It might not. You might be able to breastfeed, but it might affect your ability. So if you want to maximize your chances of being able to breastfeed, because of course not everyone is, but if you want to maximize your chances, then don't have a breast reduction prior to having children. Wait until you finished your family. What do we got? Silvana, what's that? Hand up. Dosky's joined. Big up yourself. Toby, I want uplift and implants and I want a really high look, but I might want a baby in a few years. Will it affect the girls much? Yes, it will. Especially if you want a really high look, because that really high look ain't staying. Oh no, it ain't staying. Not with children, because they stretch the skin. And that really high look, you need to have tight skin to keep that really high look. So, yeah. I said it will. It might. I mean, I don't know. It might not, but it's a bit risky because it's an expensive operation. And if you know you want to have children, then ideally you should wait. Natty, less than 2 weeks to go till my op. I'm nervous already. Don't worry. I'll be reading up about it. It'll be fine. Olivia's here. Right. What's happening over here? In terms of Facebook, are we saying? Oh, we're not saying anything. Looking dapper. Ooh, am I looking dapper? Why, thank you. I've been on my fire training or something this afternoon. Fire awareness. There you go. I'm aware of fire procedures now. Hi Tracy. Hi Olivia. Hi Roxana. Right, let's get into this, guys. What have we got here? We got a question that goes something like this. What do you think of red light, in brackets infrared, treatment for the scars? God. How am I supposed to answer that? What do I think of red light, infrared? Well, I'll tell you how I answer that. I don't know. It's a bit weird. It's funny, the cosmetic world, because there's lots of there's lots of people and there's lots of things that can be done in the cosmetic world. And I guess I'm in the cosmetic world. But I see myself more in the surgical world, and there's a huge non-surgical world out there in terms of cosmetic medicine, I suppose you'd call it, or whatever. And this lies in that cosmetic world, which I am not part. I don't really feel part of. So I don't know anything about red light treatment for scars. I tell you what I do know about scars. What I do know about scars is that they are often red and firm to start off with, and they usually fade. To be quite honest with you, the most important thing for scars, the best thing for scars, is time. With time, most scars will fade, will settle. I think if you moisturize them, if you massage them, that can help. And you need to avoid the sun, because you can get a pigmented scar if you have the sun exposure while it's active. You need to look after your skin in general terms. So you need to eat healthily, drink plenty, and avoid smoking. And that's going to maximize your chances of having good scars. In terms of treatments for scars, you normally don't need treatments, but sometimes you do need treatments if you've got a problematic scar, and that's usually a red scar or a raised scar, and there are things that can help with that. And the things that I would use are things like steroid silicone gels, and again, massage and pressure depending where it is. Laser can help with red scars. I'm not sure if this is red light infrared treatment. I think that's different to laser. I don't think they're talking about laser, but that can help with red scars. But I've got to be honest, most red scars do settle, and these things just maybe help them settle a bit quicker. So maybe it will. The best thing is to talk to someone who does it. To be honest with you, I don't do it, so I can neither confirm nor deny whether it does any good at all to scars. Rogan's joined. Oh, my phone's in there. Is that my phone? What's that? Yeah, it's my phone. Sorry, it wasn't. Was that helpful? I don't feel that was very helpful, but anyway, we'll gloss over it. Khan, a bit late. Who's a bit late? I think I was on time today, Khan. Were you a bit late? Because I think I was on time, which is unusual. Can you explain how lymphatic drainage works, and is it good to speed up recovery? This is from Tracy Bell on Facebook. Oh God, Dr. Katie's asked me a question as well. Oh God. I'll answer that, Katie, after this one. Well, again, we don't really offer or do lymphatic drainage, but basically manual lymphatic drainage is like massage, where the tissues become, when you have any sort of surgery, then you're going to get edema, you're going to get swelling, and you're going to get fluid retained in the tissues. And manual lymphatic drainage can help to drain away some of that fluid and some of that swelling. And I think it's one of those things which is not going to do any harm. I don't particularly recommend it, and some people might find benefit from it. I don't know whether it's good or bad. I think you'll often get swelling which settles, whatever you do, and it might help it to settle. And it might also be quite nice to have someone to sort of do the manual lymphatic drainage. And I think all these things are important. So it might be something that we, I wouldn't be averse to introducing it into the clinic, because I think it's not going to have many downsides, and it may have upsides. But basically, it will just help with the edema, with the fluid that collects after any sort of surgery, to drain them away. I've got to get over here because I've got to managing Facebook and Instagram. Only a few people in the country can do this. I hope you realise I've got a proper mic and everything. Dr. Katie, hi. #AskJJ. That's what I'm talking about. What happens with mammograms in a lady who had implants under the muscle? Do they take place as normal? Yes, absolutely normal. No problem at all. There's lots of people with implants under the muscle. And in fact, when we're doing breast reconstruction after cancer, you might actually reconstruct the opposite. Not reconstruct. You might actually use an implant in the opposite breast when you're reconstructing a breast. The first thing I'd ask people when I'm reconstructing a breast is, are you happy with the size and the shape of your breast? Because there's no point in reconstructing a breast to a size and shape that they're not happy with. So if they've always felt to be small, for instance, you say, well, actually, why don't we reconstruct a bigger breast and then augment the other side? But anyway, so people with breast cancer have breast implants is the point, and it's absolutely fine. Well, maybe not obviously. You have to tell them that you've got implants because they do it at a slight angle. So they do the mammogram slightly differently in order to see the breast and not have the sort of interference of the implant. But it's absolutely fine to have a mammogram if you've got implants under or over the muscle. Tracy done that. Sally Daft. Hi Sally, how you doing? Shopping list of questions. Do you use drains for tummy tuck, quilt the skin down, Vaser or normal lipo, permanent sutures in MR? Does a hernia repair well above belly button, 3 big babies between doctor bump, or is DR? Oh God, is DR an abbreviation for something, Sally? Or is that docs? You done it in capitals? Does a diastasis recti. Got it. Diastasis recti. Right. Oh, I wish you wouldn't use those things. Bump the tummy tuck price up a lot. Thank you. Wow. Right, Sally. Well done you for asking a big long question. That's going to keep us here, isn't it? XX hearts. Not many on here. What are you talking about, XX? There's 5. How many do you want? Honestly, God dear. What is... That's good for me, XX hearts. I don't know what your but I have got 1,000 subscribers on YouTube, so pretty important guy right here. So Sally, in answer to your questions, do you use drains for tummy tuck? Yes, I do, Sally. Pros and cons of drains. I think I've done a blog post on it. I'm pretty sure I have, and I still do. And I think a lot of surgeons are moving away from drains, and I understand why, because patients don't like drains. And I think there's Nah, it's all right. It's all right. I don't think I could handle much more than this, to be honest. Sorry, XX Heart says I'm worth more than this, which is very kind. So I do use drains, and I do think there is a place for drains in tummy tucks, but I think we are moving away from them. And just brings us down to the second part of your question: quilt the skin down. Yes, I do quilting stitches. Quilt the skin down sounds a bit extreme. You're quilting the soft tissues down, so that rather than having a large space with a tummy tuck, you're putting stitches underneath the skin to quilt it, a bit like a is it Chesterfield sofa? The sofa with the buttons, or a quilt with compartments in it, so that all the stuff inside the quilt doesn't just go to the end. Those. Do you know what I mean? But anyway, it's I do quilt the skin down, and that limits the drainage, and so that might be a way to do less drain, or not use drains. But at the moment, I still do use drains. But that the movement is away from them, but I still feel that they've got a place. Vaser or normal lipo, either, and I think there's a place for both. And I personally don't do Vaser. People who do Vaser say that you do get a degree of skin retraction, and I think that might be helpful in the central abdomen. I don't do liposuction in the central abdomen. The hips and thighs respond well to liposuction, so I think you can use either on the hips and thighs. The skin does tend to recoil quite well. I wouldn't use normal liposuction on the central abdomen, and so Vaser might have a place, but you really need to speak to someone who does Vaser to talk about that, to see whether that is something that can have a significant difference. I'm not 100% convinced how much difference Vaser gives compared to normal liposuction or power assisted or another type of liposuction, but yeah, so I use power assisted liposuction. And what you're looking at is you're looking at people who sound reasonable, who got good results. Never mind Vaser, normal, this, that, Zimbabwe. You could have that on paper, the best operation, but you'd have it and it looks rubbish. And you're like, but I had Vaser and I had this and I had that and I had no drains. But if it doesn't look good, well, it doesn't matter, does it? So you want to see someone who looks good and looks after you. K-Base, what are the downsides of not having drains? Downsides of not having drains. The main downside, there's two main downsides of not having drains. The number one downside is hematoma. Hematoma is blood collecting inside, and that's a bit of a worry. You think when you see the drains the next day and they've got blood in them, think, oh, crikey, what if that was in there? That might have formed a hematoma. Certainly with other operations like breast reduction, they've done studies where they've done drains and no drains. They've done drains in one side, and they said it hasn't affected the hematoma rate. So, whether that's a bit of a worry, that you might get blood collecting inside if you don't put a drain in, because certainly the first night it does tend to bleed a bit. Any wound does. If you take a mole off the head, anything like that, the first night, it does tend to bleed a bit. The second downside of not having drains, which I would say is slightly the bigger one for me, is seroma. So seroma is not blood, it's serous fluid, and it comes a week or so afterwards, and it comes in the space that's been created when you do a tummy tuck. And using drains, the drains that I use are suction drains, they're vacuum drains, so they suck the two bits of skin down together. My worry is, so a lot of people, you got to think, what are you going to use to suck those bits down together? So some people will use glue, we use tissue glue to stuck those bits together. I worry that after the op, you move a bit, you cough, would it shear, and would there be a bit of a space there, which will maybe encourage seroma? They've done a lot of studies where they've looked at it with and without drains, and they said the seroma rate is really low when you don't use drains. So they say it's safe to not use drains because you get a very low seroma rate. I have an almost zero seroma rate. I can, name the people who've had seromas. So I've got an extremely low seroma rate. So I don't want to have an acceptable seroma rate. I want to have an almost zero seroma rate. So, and I think the downside of using drains, which people don't like them and the discomfort, is worth it for the upside of potentially reducing the risk of seroma. So that is the downsides of not using drains is hematoma and seroma, and I would say mainly hematoma. So where are we? In the middle of the shopping list. So Vaser or normal, permanent stitches in MR, doesn't matter. I use interchangeable. I usually use a permanent nylon, although I often sometimes will use a PDS. Whatever you use, which is a dissolvable one, but it takes a long time to dissolve. Whatever you use a heavy suture. So it's a big suture. It's a 1 or something, which is, you're probably not going to know what a 1 is, but a 1's quite a big suture. Most sutures are like 30, 40. So they did sutures where they made sutures where they made sort of 1, 2, 3, 4. And then as they got better at making sutures, they made a suture finer than a 1. And they think, oh, crikey, what are we going to call it? It's finer than 1. So they called it an O. And then they made it even finer than an O. So they called it a 2O, 3O, 4O, 5O. So like a 5O is finer than a 2O. So a 1 is quite a heavy suture. Anyway, sorry, I've digressed. So yes, it's I use a heavy suture and either use a nylon or a PDS, and I'm happy to use either. But if you do use a dissolvable one, then you use a long-term dissolved one. And Sally, I wouldn't get too worried about this. It's not going to. Does a hernia repair well above tummy button? Does a hernia repair well above tummy button, 3 big babies, between DR, that's diastasis recti, bump the TT place up a lot? Thanks. I don't know. I mean, fixing diastasis, it depends if it's a hernia, Sally. If it's just diastasis recti, if it's just divarification of your muscles, then that's an integral part of the surgery. So it doesn't bump the price up at all. If you've got a frank hernia, so you're unlikely to have a hernia from 3 big babies. That would be diastasis recti from 3 big babies. You have a hernia from a defect in the abdominal wall. So either if it's congenital from birth, it's going to be something around your belly button, or it'll be something like if you've got a scar there, you could have an incisional hernia or some reason for a hernia. So if you've got a specific hernia and you need a hernia repair, then that's a different kettle of fish. Because if you're not going to have enough, if you've actually got a defect in the wall and you need to either try and close that defect or patch that defect with a mesh, that's a different kettle of fish. And that might even need a general surgeon coming and helping, which would bump the price up a lot. So it depends whether it's just divarification of the recti, in which case it doesn't bump the price up at all. It's an integral part. Or if it's a frank hernia that needs repairing, which in case it probably would, but it definitely would bump the price up a lot, because that would be an extra level of complexity right there. Is that it? Is that it, Sally? Have I? It's a hernia. Oh, Sally says it's a hernia down here. Yeah, well, it probably would, Sally. Yeah, because that will probably need specific repair. So if it's a hernia, and as I say, you wouldn't get a hernia from having babies. A hernia is a defect in the abdominal wall. So that defect then needs to be repaired. So it either needs to be repaired, because they call it, when you have divarification of the recti, we call it muscle repair. It's not really muscle repair. There's no hole in the abdominal wall. There's no defect. We're just bringing the muscles closer together. A hernia is a defect that needs to be repaired. So you either need to stitch that together if there's enough laxity, but the fact there's a hernia there means that there might be a deficit. And if there's a deficit, then you have to get into using meshes, which would which would certainly increase the price because the mesh themselves cost a lot of money, and would also increase the complexity and increase the risk of complications, because particularly if you're introducing a prosthetic mesh and what have you. So that would have to be taken into account. So that does make it a bigger op, Sally. So what's happening? Dr. Katie, sorry, I may have missed your reply to the question if was answered due to poor connection. What did I... under the muscle, yes, you can have a mammogram with the implants under the muscle or over the muscle. It's absolutely fine, Dr. Katie. But you need to let them know you've got implants because they have to do it at a slight angle, so they have to do it slightly differently. XHLS Heart Mum, sorry, can you make a silk purse out of a sow's ear? I'll be sensible now. Very good, thank you. No, I can't. Makes sense. Is it mainly common you have a muscle repair with all tummy tucks? I would say most tummy tucks. I wouldn't say all. I wouldn't say 100%. I would say most, because the skin has been stretched, so the muscles have often been stretched apart. So you usually have to bring them together, I would say. I wouldn't say all. Sally, can't you have a hernia done on the GP, NHS from GP? Sally, XLS Heart Mom on Instagram is saying, can you go to the GP? Yes, you might be able to go to the GP with a hernia. The only slight problem with doing that is if they were going to repair the hernia, they would probably just make a cut here and repair the hernia. And then if you've got a cut there, that messes up the need for a tummy tuck. So you'd probably be much better off having it done at the time of a tummy tuck, because then you'd have the tummy tuck scar in your lower abdomen. So I can understand why you would perhaps prefer to have it done like that, at the time of a tummy tuck. Wait a minute, what's going on? Oh, I've got to do the chat in order. It's between the diastasis. Okay. Would you know at consultation with hernia, and if you need a general surgeon too? Yes, but they won't do cosmetic or DR repair. Yeah. If you've got a hernia, Sally, it would probably be worth getting some imaging. So have you got any imaging? You'd look at getting probably an MRI or some kind of imaging of your abdomen to look at the extent of the hernia and look at the contents of the hernia to see if there's actual bowel in the hernia, because you don't want to be running into that area. And then based on that, you would decide whether you would need help from a general surgeon. So you perhaps wouldn't be able to know a consultation. So if you know you've got a hernia, well, have you had some imaging? Is that why you know you've got a hernia? Or, yeah. Right, what's Olivia got? Is the continued wearing of my binder helpful with my stomach hematoma, or is it a bad thing? What are you saying, Olivia? Are you saying you've got a stomach hematoma? If you've got a hematoma, so hematomas are usually drained in theatre. You normally have to go back to theatre and have a hematoma drained. But if it's not bad, if it's not that much of a hematoma, then it's just sort of a bit of swelling, then I guess you wouldn't necessarily have to have it drained, particularly if it's not expanding. So yes, I would have thought the wearing of the binder would help, but it has to be supportive rather than compressive. So it doesn't want to have to be like when you take it off, you breathe a sigh of relief. It's got to be supportive and comfortable. But here we go, Olivia. 4 months post-op. Olivia, I said this to you before, you've got to stick with your surgeon, talk to your surgeon, because it's not really right for me to be, telling you whether you wear your binder or not. That's up to your surgeon, really. Sally, thank you. Thumbs up yourself. Is that right? Did I cause my hematoma by overexertion? Probably not, no. Unless you've done, and you've gone crazy at the gym day 3 or something. But if you've gone really at it, you might have pulled a stitch or something, but probably not. Anyone can get hematomas. It's just a risk of doing the surgery. What's going on here? What's going on here? Hello. I did not have muscle repair with my tummy tuck. Not needed, apparently. There you go. Olivia didn't have it, so it wasn't needed. Sally, hernia literally popped out like an alien when pregnant. Too much info. I'll shut up now. I've got internal camera. Internal camera. Oh, my God. Internal camera packs. God. Dear, oh, dear. Yeah, I'm not... If it's by your belly button, then maybe it is a hernia. But actually, it might just be... Are you sure it's not just divarification erecti? Do you know it's a hernia? Because if you haven't had imaging, I would say that you don't know whether it's a defect in the wall or just divarification. But anyway, if you've been told it's a hernia, then maybe it is. Oh God, it's all kicking off now. I do need someone. I need help. Anyone out there who wants to like manage the? I'll talk. They just say to me, right, next question. Yeah, that's what I want. Part of my assistant passes me the next question. Right, I try. Hernia, right? Rosie Hudson Smith. What does your BMI have to be for a tummy tuck? Oh, that's a good. That's a short, succinct question. But is the answer going to be short and succinct? That's the thing. Good question, Rosie. There's a short answer, which is 30, if that's helpful. So the short answer is 30 in terms of a lot of people will say your BMI has to be below 30 if you're going to have a tummy tuck or something like that, because you're going to get better result if you have below 30. The long answer is the lower your BMI, the better. The lower your BMI, the less risk of complications, the better result you're going to have, particularly if you're not happy with your weight. Don't have a tummy tuck for weight loss reasons. If you're not happy with your weight, you are far better off losing your weight first. And I know what you're going to say. I can't lose weight because I've got this big abdominal apron, or I'll be able to lose weight a lot better when I have my tummy tuck, and I can appreciate that. But in terms of a surgical result, you can have a much better result if you lose weight first. Your complications are going to be less. And also, if you lose weight after surgery, you might have some redundant skin there, which could have been removed and made tighter if you've lost the weight first. Having said that, for me, I don't have a BMI sort of set in stone. It's not like 30, gone, below 30, you're fine, because your BMI might be below 30 and you might want to lose weight. I'm like, well, don't have the tummy tuck yet. Wait until you've lost weight. And similarly, your BMI might be above 30 and I might do the surgery. If you've lost it, so these people who've had BMIs of 45, they drop down to 33 or 32 or something, it's pretty tough to say, oh, you've got to get down to 30. So if particularly people who've lost a lot of weight, sometimes the BMI is above 30. So it's not written in stone, but if you want to get the best result, the lower the better. And 30 is the guideline that a lot of us use. Olivia, yes, I have a hematoma. Doctor would not drain it. Well, there you go. Maybe it wasn't big enough to drain. Olivia, and back in the UK now, my binder is a bit weary now. So not overly tight. Good. Well, you don't want it overly tight, Olivia. Again, talk to your doctor about what to wear. I sometimes wear the big pants and things if the binder's not doing the job. Randy, Olivia Pemberton, message this number on WhatsApp, and you can also text him on his mobile. He got me 5,000 into my Cash App account. He's real and legit. Sorry, what is this? What? Have I been hacked? Oh my God, she's saying it to everybody. Can't? What? Not? Sorry. Who's Randy James? Not the gym. Other stuff. Randy, what are you doing, man? Is Randy? Right, I'm gonna do Randy. Can I block Randy? Can I do Randy? What? Well, I guess I guess he's getting my comments up, but he's saying, what's he on about? See, I told you I need an assistant before this happened. Right. Well, Randy might have stopped now. If Randy stopped, Randy, can you stop that, please? Randy, stop it. I'm watching. Good. You don't stop it, I'm going to block you. I don't know how to block you, but I will find a way. You heard me. Right, where are we at? Sorry about that, people. Randy James is nothing to do with me, and I don't know what he's going on about with that WhatsApp number. So Olivia's wary with a binder. Yep. Not the gym, other stuff. It's between bra strap and belly button. Well, that's where a divarification would be, Sally. Tracy, no thanks. Are you saying no thanks to Randy James? Sorry, Tracy. Yeah, I say no thanks to Randy. JJ, did you see the message I was just sent by Randy James? I did, Olivia. I think he sent it to everybody. I don't know what to say. I think it's it looks a bit, well, it looks very not right, doesn't it? Nothing to do with me anyway. Kay Babes, where do you operate from and how long is your waiting list? Hey Kay, I've got an operating room in my clinic. So I do minor procedures, moles and stuff like that. Major procedures, I'm mainly at the moment as we speak doing it in Liverpool. There's a friend of mine who's got a place up in Liverpool in Wiston. And that's where I'm doing all my GA and my bigger procedures. There is, as I said earlier, evidence that the operating in the Midlands is going to come back again. We're starting to look at maybe getting some lists in Droitwich, maybe at Parkway. So I think they are giving us lists, and I think it's a bit sporadic and ad hoc is the problem. But hopefully it'll be coming back soon in the Midlands. Farah Man, if the BMI is 2.5, is it acceptable for a tummy tuck? Farah Man, do you mean 2.5? 2.5 is a little BMI. A little BMI. Actually be a really tall person with like not much weight. I think you mean 25, or maybe 2.5 is maybe you're doing it in it's kilograms per meter squared, isn't it? So 2.5 could be in anyway, I would call it 25. But 25 is good. 25 is normal BMI, Farah. The main thing is you've got to be happy with your weight. So there's two things with the BMI. One is the 30 thing, which is an arbitrary thing. But the second thing is, are you happy and stable with your weight? If you're not happy and stable with your weight, you're better off getting happy and stable before having a tummy tuck, whatever your BMI is. So even if your BMI is 25 and you want to lose weight or put on weight or whatever, do it first before having a tummy tuck, because you get a better result if you are stable and happy with your weight. What's going on? I've got to try and get through Randy James's messages. Thank you for your helpful answers. I'll no doubt be along to see you in person end of this year for consult. Yes, Sally, I'd be interested to see what's going on. I will help if I can. Tracy, I got that message too. I know, I think everyone did. Bit dodgy. Yes, it was dodgy. I'm sorry. I've not got a sideline in doing WhatsApp texting. Yes. Can I delete? I'll delete them if I can. I'm not on Facebook. I'm on a funny. That's why I get this up. It's not on Facebook. I'm on a sort of separate thing. So when I get back, I'll get on Facebook after this, and I'll delete the messages and I'll do what I need to do. Don't you worry. Bit dodgy. My skin is so thin at the bottom of the apron. How would they do it? Sorry, Rosie. How would they do what? Is it a tummy? What does your BMI have to be for a tummy? Is it a tummy tuck, Rosie? Are we saying a tummy tuck? Yeah, they would do it fine, Rosie. When you do a tummy tuck, the wound is under tension, obviously, because you want a tight abdomen. And what we do is we try and take the tension off the skin by putting quite a lot of dissolvable sutures underneath the skin. So there's 3 layers of sutures. There's a very deep layer of strong sutures, quite deep down, taking the tension off. Then there's another layer just underneath the skin, and then there's a final layer in the skin. So even if the skin itself is thin, a lot of the tension will be taken off before we put the skin suture in. So hopefully when we put the skin suture in, there isn't a huge amount of tension. So I think you'd find that we'd be fine doing that, Rosie. So don't worry about it. That's our problem and we will be fine. I think we've been getting spam messages. I'm sorry, Tracy. Is it my fault? Are you still getting spam messages? Kick Randy off. Oh my God. They're revolting. The people are revolting. You're revolting, guys. Stop revolting. Block him. How do I do that? I don't know how to do that. Go Facebook, open another page. He's gone, hasn't he? Has he gone? Look, he's gone. I'll do it afterwards. Whatever. I don't even know how to block people. I don't know how to kick people off. But after this, I will. I should know, shouldn't I? After this, I will get on and delete the messages or something. I hope I haven't spam done anything. It's nothing to do with me anyway. Rosie, can the skin be pulled down instead of pulled up? It is always pulled down, Rosie, because you want the skin, the scar to meet the lower incision. So it is always pulled down. It's not pulled up. Rosie, are we talking about tummy tuck here? Because I don't want to be talking about the wrong op. Let's assume we're talking about tummy tuck. So yes, the skin is pulled down. It's not pulled up. Yeah, let's not give him. Come on, let's not mention him, Sophie. Roxana, I've just had a message from him. Roxana, it's nothing to do with me. Who's? I don't know. I don't know what to say. This is I don't know. It's nothing to do with me. Oh God. Hi Cheryl. God, what a nightmare. God. Yeah. Hi Cheryl. Hi JJ. Booked in for August, so hopefully you have earlier dates coming available. Can't wait. Booked in for August. Booked in for a clinic in August, is it? So hopefully you have earlier dates coming available. Good. Cheryl, keep close. Call us, yeah? Keep in touch. We'll let you know what's going on. Nicola, Megan, the team will let you know what's going on. Liz, hashtag Ask JJ. Respect to you, Liz. Appreciate that use of the hashtag. I have very stretched skin on my lower tummy under my belly button, meaning the skin has very deep, wide grooves for stretch marks. The skin seems very thin. Would this make a tummy tuck difficult to perform? Would results be affected? Sounds like you're a good candidate for a tummy tuck there, Liz. I mean, that skin all goes. So if you've got deep stretch marks or, you don't like the skin from your belly button down to your pubic area, perfect, because that skin all goes. It all gets thrown away, and the skin just above your belly button then gets pulled down to your pubic area. So deep stretch marks, and if the skin looks unsightly, then that's great because that's all gets removed. So that sounds like no, I don't think your tummy tuck would be difficult to perform based on that. I mean, yeah, it sounds like you'd be a good candidate based on that. But obviously, you have to see you and stuff. But that in itself is not a problem. I have literally just asked this question, thinking the same. Yeah. Yes, he's gone. Yeah. So let's be quiet and hopefully he won't find out that we're still here. Melody, individuals can block him, I think. There you go. You guys block him. And I will block him if I presume you right click and I don't know, block a thing. Cheryl, see you next week, Wednesday. Looking forward to it, Cheryl. Looking forward to it already. Cannot wait. Next Wednesday. Right. Oh, look at this. What's going on here? Bit of a saucy question here, Instagram people. On Facebook, I'm glad you can't see it. It's up on screen. How soon after mummy makeover can you have sex? It's a bit awkward. I wonder who asked that. It's an awkward one, isn't it? Blimey. Has anyone had a mummy makeover out there? Can they answer that question? Well, your wound's healed in a week. You'll be I don't know, 6 weeks. I don't know what. God, I don't. What's the normal sort of rate? If I say, is that a long time? God, I'm out of depth here. 6 weeks or 4 weeks, maybe. I guess it's just when you feel comfortable, and you got to like not do, just sort of take it easy because a mummy makeover is a breast thing as well. So you just want to sort of go easy on those areas. Listen to your body, all right? Listen to your body is the answer to that one. I'd say, glug. Oh, Melody, 6 weeks. There you go. Melody was told 6 weeks. It's good enough for me after my FDL. 6 weeks, guys. There you go. Good. Crikey. Next question. Does a tummy tuck and Mons lift help improve the pelvic floor muscles? No, it doesn't. No, it doesn't really do anything to the muscles, Tracy. I'm sorry to say. You obviously can strengthen those floor muscles, and obviously, well, not obviously, but those muscles are sort of stretched or damaged when you have a child, just like your rectus muscles. But your rectus muscles are on the front. The pelvic floor muscles are at the sort of at the bottom of the square, and we're just operating on the front piece of the square. If the cube. Can you picture that? It's in my head, the cube. Yeah, we were offering on that. The pelvic floor is the bottom of the cube. Yeah. Anyway, no, they're not affected doing a tummy tuck and a Mons lift. So no. What's this? Tracy's. What is everyone laugh? These laughter. These are laughters, right? Okay, making me laugh. Right. Okay. I don't know who's putting embarrassing question. Let's have a non-embarrassing. Let's have a better question. This is a better question. This is what we want. Right. I hear of people using walking frames after mummy makeover to remove tension from scars. Do you recommend this? No, I do not recommend this. I think in general, things like walking frames and crutches and things like that, walking aids, you shouldn't really use them unless you need them. So if you don't need them, you should be able to walk over your own power. And I think walking frames and things, no, I don't think that's something to get into. It's only a couple of weeks you'll be walking over, and I think it's just a bad thing to get into, to get reliant on something like a frame. So I do not recommend things like that. I think you're better off, if you can avoid using them, to avoid using them, because the more you sort of rely on them, the more you get used to them, and you're less likely to get off them. Whereas if you don't start with them, same for crutches. Just don't start with them. And if you don't, I mean, if you need them, fine. But for a mummy makeover, you don't need it. So I would not recommend that at all. You was blushing. Was I blushing, Trey? Well, can you blame me? Did you see what they're trying to do to me? Right. Okay. What we got? Do you recommend being up and out of bed immediately after mummy makeover? Yeah. Oh, definitely. Yeah. Definitely. Yes, I do recommend being up and out of bed straight away. DVT is the thing. DVT, clots in your legs, can fly up in your lungs due to immobility. So the quicker you can get out of bed, the better. So yeah, get out of bed, walk, and if you're not able to, if you're uncomfortable, move your ankles, move your hips and knees and all that sort of thing. Keep everything circulating. But definitely, I think that is important. K-babes, do you have a set way of doing a belly button shape when doing a tummy tuck? I've seen lots of different types of belly buttons post-surgery, some with big round scars on the outside and some not. I do, Kay, and I think everyone, or I think, most plastic surgeons do have set ways. Sometimes people make a vertical slit, sometimes horizontal, sometimes they'll cut a circle, an oval. I actually cut a U in order to get a sort of shield shape. Some cut an N. So anytime there's lots of ways of doing it, means there's no one good way of doing it. But I cut a U that then opens up to a sort of shield shape that gives you a superior hood, and I try and put some sutures in to make the belly button sit in a depression with a superior hood. But yes, you're absolutely right. There are different ways of doing it. So look at some photos to have a look to see what you think of the belly buttons that you see. Tracy, does a tummy tuck improve posture? No, initially it will make it bad because you have to bend over and your back hurts and all those sorts of things. And then it will come back to normal. One of the things about a tummy tuck, particularly if you have got a significant divarification of your recti, you do bring those muscles together. So people talk about your core strength, core stability being improved. I wouldn't like to guarantee that, and I wouldn't like to make that being a sort of selling point of a tummy tuck. It might improve your posture. It might improve your core. But I wouldn't make it a big. So I would, if you ask the question, I'd probably say no. It'll be the same, and you have to work. If your posture's poor, you have to do things to improve your posture. But it does improve it does bring your recti muscles together, which will improve your core stability and might have an effect. But it would have to be looked on as a potential happy side effect, as opposed to a primary reason for having the surgery. It's a primary reason for having the surgery. I'll be thinking, well, it might not, do that. So hard to guarantee. I have a lot of fat on my thighs. Would it be better to have a Vaser liposuction rather than a lift? Would you be able to help? And is something you do at your clinic? I would not be able to help with Vaser liposuction because it is not something that we do at the clinic. I haven't really embraced Vaser liposuction. I do understand it is a thing, and a lot of people talk about it and ask for it. So you'd probably be better off talking to someone who does Vaser liposuction rather than myself. But anyway, I'll talk in general terms. A lot of fat on your thighs. Would you better have the Vaser liposuction rather than it? I would say my opinion on that is fat on your thighs depends on where the fat is. Medial or lateral thigh. So lateral thigh, the outsides of your thighs, that can respond well to liposuction. Medial thigh, the inside of the thigh, responds less well. The other thing about the outer thighs is weight loss can help those areas. And I know people say, I don't want to lose weight or won the lottery and all that sort of stuff. The best thing for to get rid of fat is weight loss, because that means you've got you're not going to get any dents or contour irregularities, which are a risk when you do liposuction. But in my experience, inner thighs does not respond so well because the skin doesn't retract. Having said that, Vaser liposuction says that they say that it does cause some degree of skin retraction. So you might find someone who's getting good results with Vaser. It's about looking at results and seeing what you can see. But I would be wary, and I think for me anyway, I normally say a thigh lift. But as I say, if you can get some degree of skin retraction, it might be a goer. Vaser might be a goer. So that might be a good indication for Vaser there. Jane, how are you doing, Jane? As breasts drop naturally with age, could the chances of this be lessened by using polyurethane implants as opposed to textured? Wow, I should. Sorry, I feel I didn't. I'll say that very clearly for my Instagram friends. As breasts drop naturally with age, could the chances of this be lessened by using polyurethane implants as opposed to textured? That's quite an informed question. I think, again, I would not say that would be the case. The thing about implants, and you're absolutely right in thinking that polyurethane implants are more likely to stay in position. Polyurethane implants are much less likely to move, and particularly with the teardrop, you're not going to get malposition when compared to silicone implants. The thing that normally happens with breasts with age is the breast droops, because the breast is acted on by gravity, not the implant. So often what happens is the implant sits there and then the breast falls off the implant. And so whether it's polyurethane or silicone, the implant, once it's established, just normally sits there. And then over time, it's the breast that falls off the implant rather than the implant dragging the breast down. So I would say it's going to be the same. I don't think, or I certainly don't know of any evidence that says that a polyurethane implant is more likely to age better in terms of the shape of the breast. It's certainly more likely to age better in terms of the risk of capsular contracture, but in terms of the shape of the breast, I'm not sure if you could say that it's less likely to drop, because it's the actual tissues of your skin and your breast that drop due to age or having children or weight changes. It's that skin and that the breast tissue that's going to drop, not the implant. Sorry, where are we? As breasts drop, that's done. Randy James, go away and scam someone else. Amen, Khan. You tell Randy, get it out, man. We don't want you. Samantha, how many times after a tummy tuck do average patients have to visit you for aftercare? Thanks. No such thing as an average patient, Samantha. All our patients are special. Tummy tuck aftercare would be 1 week to see Vicky. Well, normally Vicky will give you a call a day or two after the surgery, see how you're getting on. Right, well, let's start at the beginning. You'll be in hospital, as I said, do use drains, stay in overnight, at least one night. Drains come out before you go home, then you go home. Vicky will catch up with you by phone a couple of days later, see how you're getting on. You'll have a binder on and all these dressings and stuff. After a week, you come back to the clinic. So you'd have to visit for that, to take the dressings off and see what's what. And you normally don't need another dressing after that. Make sure the binder's fitting okay, etc. So 1 week to see Vicky. Then I normally catch up with you about 6 weeks. Scars probably all red and firm, probably still some swelling there. Mainly just looking at the healing and things. Get you massaging the scar, talk to you about scar management. Then 3 months. Maybe things are settling, 3-4 months. Maybe things are starting to settle now, but there probably won't be scar, be a bit red, still a bit swollen. So then normally do it 6 months, then a year, then yearly. So that's the sort of normal regime. We do 1 week Vicky, then 6 weeks me, then 3 months, 6 months, year, and yearly, give or take. If you've got problems, we'll do it more often. If you've got no problems, you don't have to. You can say, look, I've got no problems. I don't want to come back. If the scar's beautiful at a year and everything's fine. But that's sort of, it's that sort of regime. I like to keep an eye on people. So I offer people yearly appointments after a year or so, just to keep them in the system. But for something like a tummy tuck, to be honest with you, once it's done and the scar's good, if your weight's pretty stable, that's it really. But you don't have to keep coming back. Whether or not you come back, we always say, look, there's an open appointment for everybody. So if you have any problems or issues or something, you can come back at any time. So even if you have problems between those appointments, then just give us a ring. You come back and we rap about it. Right. Tracy, my implants have fell off my boobs. So what you are, okay, so were you asking, oh no, Jane was asking about polyurethane. So yes, so I said that the implant, the breast fell off the implant. So there is a risk that you can have the implants descending. So this is bottoming out. So in terms of aging, it's usually the breast that falls off, but the implant can descend. So if you do have a problem with malposition, so if the implant does descend and bottom out, then yes, polyurethane implants are a good way to treat this, and polyurethane implants are less likely to do this. So that's maybe going back to Jane's question about as breasts drop naturally with age, could polyurethane? Well, no, that's saying as breast drop. If you have a complication with the implant in terms of the implant descending lower than the pocket, that's bottoming out and more likely to have silicone compared to polyurethane. So I'm sorry to hear that, Tracy. I'm 50 and they're nearly 12 years old now. Well, there you go. Maybe if you're not happy with the shape, Tracy, it might be worth seeing your surgeon to see what's what. Rachel, I had a thigh-plasty. One looks great, the other looks very similar to before. I'm 4 weeks out. Is that normal? I wouldn't say normal. Rachel, no. But I would say 4 weeks is in the early days. And as with anything, always best to stick with your surgeon. They will know what's what. They will know if they've done more on one side than the other. And I definitely would actually see a surgeon and see what's going on there, because it might be swelling, or it might be this or that. They might have had something in the surgery. But no, I wouldn't say it's normal 1 week to have one looking normal and one looking like it looked pre-op, but I would say it's normal for things to not look the same at 4 weeks. And that's the problem with a lot of the surgery that we do. It's two of them, 2 thighs, 2 arms, 2 breasts, 2 eyes, so you think this one looks great, but this one's all swollen. If you just had one and it was all swollen, you say, oh, it's normally swollen, don't worry about it. But then when you got another one to actually compare it with on the other side, you say, but what about that one? So that is the problem, that when you're doing two things, that maybe it doesn't always settle at the same rate. So 4 weeks is early days, Rachel, but stick with your surgeon and don't make any long-term decisions. That's what I would say. About 3 months for things to start to settle, I normally say to people. Tracy, how long do you keep the binder on for, and how do you know what size to buy? We put the binder on you in theatre, Tracy, and it's a month, day and night. And so we will advise you about the size, but we will put one on in theatre. They come usually small, medium, large and stuff like that. Dominique's here on Instagram. Hi, Dominique. Nice to see you. Long time no see. Hope you're all right and surviving your locking down. Tracy, I'm having a mummy makeover uplift with new implants. Go, girl. You go. Yeah. Good on you. Rachel, I don't want to sound like I'm complaining. Well, Rachel, I guess it depends on how you say it. So, if it was me, Rachel, I would say, look, you're better off saying to your surgeon rather than saying to some random guy on the internet, one's swollen, one's not. You're better off speaking to your surgeon. And I think it's perfectly reasonable. I think we have often, to be fair, people saying that this is a bit not right. The one's bigger and this and that. And they're not complaining. They're just saying, look, this one's a bit bigger than that one. Is that all right? I'm worried. It's not complaining. It's not like saying, one's bigger than the other. Why didn't you do it properly on that side? And you messed up the other side. That's complaining. Whereas, I'm a bit worried. This one seems to be a bit swollen. Is that okay? It's not complaining, is it? Don't worry, Rachel. Presumably you paid for this. Well, even if you didn't pay for this, but you paid. It's a doctor and he's got to look after you. Yeah, we don't have to complain. Why is my tattoo not suitable for excision? Now we're in for a treat now, guys, because I am going to seamlessly put the tattoo photo on the stream, and quick as a wink, I'm going to watch this Instagram. What do you say about that? How pro is that? Why is my tattoo not suitable for surgery? Sometimes I do think, it's interesting because when we started doing tattoos, it was obvious to me that you could remove a tattoo by excision. A lot of people are like, what? You can remove a tattoo by excision? That's crazy, really? I'm like, well, yeah, of course, just cut out the skin. But obviously that, obviously maybe, my mind's maybe different to other people's minds. So that is way not suitable for excision. If you think of how much skin would have to be removed from your hand, I don't know if it's just the sword in the middle or if it's the ones on each of the fingers that they want removed. So if you can't see it, well, I hope you can see it. But if you're on the podcast, so guys, this is on a podcast I just put it on a podcast. It's on, so if you like listening to podcasts, yeah, you can listen to this on a podcast. Anyway, subscribe to my podcast. It's called the Staiano Clinic, and it's available on all podcast things, places. So this is a massive sword down the middle of the back of the hand, extending onto the base of the middle finger, with also fairly large tattoos on the base of the index ring and small finger. So just looking at the sword itself is fairly bad, but not too bad. But the problem is it's got the hilt of the sword, the cross bit, and that is really just going to make it a nightmare to remove. The good thing about it is it's longitudinally orientated, so that is where you want to have a scar, that way rather than across the hand. You want to have it going up and down the hand so that when you make a fist it's not under tension. But even without the hilt of the sword, it would be very tight and a very nasty scar on the back of the hand. With the hilt, I think it was safe to say that it would be not a goer. And each of the ones on the finger, although they're small, they are taking up the whole of the dorsum of the finger, all of the hair-bearing skin on the back of the base of the fingers. And, you just couldn't close that up. There's just not enough skin. So I've always said it depends on the size and the location. So the size may be small, but the location is really bad. The skin is really tight. So I'm sorry to say that tattoo is not a goer for excision. It's not a suitable one. So I'm very sorry about that. We probably say no to more. Well, no, probably about it. We do say no to more than we say yes to. And I'm sorry about that, but it does depend on the size and location, and we've just got to be realistic about what we can achieve. So yeah. So I normally say if you pinch, so often you pinch the back of the hands, they got loads, then you make a fist, it's gone. Pinch the back of the finger, there's no way you can pinch that much skin on the back of the finger, particularly if you take into account the fact that the finger moves. So how'd it go with the new audio? I haven't done the audio on Instagram. The only way I can do the audio on Instagram is do this, do these earpieces. But I think the audio is okay on Instagram. Is it? It's Facebook's the problem. It's always cutting out and stuff. So I hope that's all right. I'm sorry about the spam earlier on, and I will see if I can, delete the messages or something. But if you enjoyed this week's episode, please join me next week, where I will be answering more questions about plastic surgery and, just plastic surgery mainly. Next Tuesday night, 7:00. I was very happy with this, but does it look a bit ridiculous? Dusting. Anyway, so yes. So, anyone else got a question? Any other questions? Because I can answer them. If there's no other questions, then I will sign off, and I will see you here next week at 7:00. Facebook, Instagram, and I have reason to believe YouTube too. If you haven't subscribed to the YouTube channel, what are you thinking of? Surely you have already. We've got 1,100 followers. Let's make it 1,101. Got any questions, message me, get in phone, email, Instagram, whatever. Jackie is a legend. Can I not like that comment? Stay safe, Jackie, you too. And I will. Sally says, thank you for your time. Sally, you're more than welcome. You're more than welcome, Sally. Thank you for your questions. Great questions from Sally. And I will see you all next week. Jackie, is the audio... Jackie, you are the Instagram queen. Is the audio all right on Instagram? Is it? Because I could plug in my headphones, but then I'd be doing it like this. And I always think people look a bit ridiculous when they do it like that. I could do it like that. Shall I do it now? I'll do it now, right at the end. I wonder if I should turn Facebook off. I'll do it now. Here's the audio. Right, this is the audio without it. How's that? That's the audio with it. I could do it like this and like that, and then I'd be an audio king. I've got Facebook. It's brilliant. It's brilliant with the white things in. Is it better now than it was a minute ago? Sorry, Facebook. Thank you for the time. Thank you, Sally. I'll sign off on Facebook. See you next week. Jackie says it's brilliant. And stay safe, guys.